So what are the differences between hair transplantation between men and women? My name is Dr. Anthony Froh. I'm the director of Philadelphia Hair Restoration.
I'm Dr. Knapp, Assistant Director at Hair Restoration.
The differences between men and women seeking hair transplantation include a very large thing, and that's the production of DHT, which is a hormone that men manufacture from testosterone. And because women have less testosterone, number one, they suffer less hair loss, but the pattern of their hair loss is also different. Male pattern baldness include the temporal areas here it's a very common area. The crown of the head are two major areas, and then anywhere in between. Largely, women have focal or areas of thinning, for example, where they might part their hair. They also, in the temple regions, they can have receding it.
What can cause a woman to lose hair? So one of the reasons why a woman loses hair is introducing alopecia, especially women in 40s and 50 heading towards menopause. Their estrogen level drops. Their testosterone level can't actually overcome that estrogen, lower estrogen level. Other baby medical condition, thyroid, especially under production, thyroid can cause hair loss, and acute stress, iron deficiency, self-infliction or habits such as hair pulling, and attraction alopecia with women wearing extensions and things of that nature. Mechanical loss of hair. Is there a difference between the technique between men and women hair transplantation? The answer is no. The technique is identical. If a woman has long hair, she can conceal the small shade hair in the back of her head with a comb over. So what makes you a good candidate for a hair transplant as a woman? Or really, there's any woman, honestly, it's your own personal decision. Nothing will exclude or include one woman versus another. What are some perhaps unique differences between the post-operative hair, assuming the woman has long hair, for example? Keep in mind that we don't want a traction very, very tight on the transplanted hair. So you can devise a loose ponytail if you want to, that's not pulling in the area right next to where the transplantation was done. Certainly bands around the head in terms of putting makeup on and things of that nature. We need to avoid any tight bands going on the transplanted area. And hot irons, for example, are damaging to even natural hair, and certainly they're going to be damaging to the little baby hairs that have been transplanted, the follicles from the back to the donor area. So hair dryers, for example, can be used, but they have to be kept at a distance from the hair to avoid overheating. And again, isolating the heat, if you will. And products such as hairsprays and so forth should be avoided a good week or so afterwards. Goes the same for other products such as mousses and so forth. As brushing or grooming is concerned, the hair can be brushed. Again, you have to do it in an isolated way as to not cause, the big word again comes up with traction. You don't want to cause any traction on the scalp where the transplantation was done. As far as brushing over the back area where the donor site was, you can feel free to brush in that area because you're not damaging any of the transplanted follicles. So braided hairstyles is also a method of traction. The hairs have to be hot, if you will, and braided in next tension. So you want to avoid braiding the hair anywhere near where, again, the hairs have been transplanted. Now, if you want to braid in the back, again, where the donor site was done, that's not a problem. A braided hairstyle, for example, in the frontal area, assuming if a patient has had transplantation in the upper regions, should really wait a full month before any braids are done in those areas. When can you expect to see a result, and how long transplantation lasts? So hair transplantation is a permanent solution. We use the hair from back of your head, the donor area. Genetically, this part is a permanent hair. So once they are relocated, they will just grow forever unless you put them out. We have to wait anywhere between 3 to 5 months to see any baby hair come out. Over the months that pass by, they will become thicker. Full process usually takes anywhere between 10 months to 12 months to see for the result.
As a woman, in terms of waiting for, if we can call it, final result of your hair transplantation, you have to go back to what length of hair you're used to or you like. If you're short hair, then the total length, let's say, from having no hair to the total length is really almost mathematic. So if you wore your hair, let's say 3 inches long, then the total 3 inches is going to take a shorter amount of time versus if you wore your hair a foot long. Then the length from the time the follicle was transplanted, for that entire hair, those hair follicles to grow the whole foot would be the natural course of hair growth, almost as if you've got a haircut and then you're just waiting for the hair to regrow after your haircut. It's going to be the same rate of growth pretty much as the rest of the hair on your head, because it's going to come from a high growth area. So it's not going to differ in the rate of growth than the rest of your scalp.